Good morning, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation here with you on this Saturday morning, March 28th, live with world-renowned vascular birthmarks, anomalies, and related syndromes expert, Dr. Milton Waner, on my other iPad next to me. We're here today to answer questions that you may have regarding COVID-19 as it relates to port wine stains, hemangiomas, lymphatic malformations, venous malformations, and other vascular anomalies. So we have some people already logging on, so they're joining. So before let me see if it's on my phone here. I'm trying to see that it's live so I can read the questions. So Ava Piles, Elahi, Sergey is on, Aaron's on. I'm seeing a lot of people that are popping on. Okay, so let me just get to here because I want to see if we have any questions coming in. Hi, everybody. Welcome to our Facebook Live. We have good morning from Tara Garrett, Sippy, Ava Piles, Rhonda Craig. A lot of people are saying good morning. Good morning, everybody. I'm here with Dr. Waner. Mentor is on. So we have 20 people on right now, and I'm not seeing any questions. Good morning, Dr. Waner, from Michelle Lai.
Hi, Michelle.
Corinne is on from Seattle. Ava Piles is on. You just saw Ava. So maybe first questions before questions actually start coming in. What about patients who have surgery scheduled with you, Dr. Waner, for within the next month? What are you telling them?
Okay, so there's a directive from the government, so all elective surgeries that are non-urgent are postponed for now. That date may get pushed forward, but I think it's sometime in April. What's the exact date, Linda?
April 15th.
Yeah, so, I think April 15th is pretty reasonable because by then we're going to see exactly what this is saying. So, as far as we're concerned, if a surgery is urgent, we will continue and do it. That's the directive. If the surgery is not urgent, we will postpone it. So, what's urgent and what's not urgent. I think that definition is a little open, and I think that, unfortunately, it's open to interpretation. If a patient is on a series of port wine stain treatments and being treated every 6 weeks, for instance, it's possible to push one of those treatments forward an extra couple of weeks. That's really not going to make much of a difference. If a patient has an ulcerated hemangioma that's bleeding and causing problems, that's an emergency. So that gives you some idea of the spectrum of things. So we're pushing surgeries forward. I don't want to jump the gun here, but we do telemedicine. I'm available to be contacted, and sometimes on telemedicine, if there is an emergency and you're unable to really evaluate the patient, it's possible for me to actually see a patient in my office. My office is closed for now, but I will go in and see individual patients on an as-needed basis. So that kind of gives you where we're at the moment.
Will patients be able to get to your office in New York City with all the transit issues?
Yeah, they should be able to. I mean, traffic is still flowing. People are still driving around, although the roads are empty, but you can still get to where you need to go. And we don't have the situation like they have in Italy and France where you have to fill out a form every time you need to go somewhere. So we're not at that situation.
And I know a lot of people have been writing to make sure that you're okay and everybody's okay in your family, and I've told them all that we're both okay. So the telemedicine phone number for Dr. Waner is 212-434 4050. So if one of the VBF staff that's on could post that number, it's 212-434-4050. And that's Dr. Waner's telemedicine office number for anyone that has any questions or concerns. The other thing I want to mention and get your opinion on is I spoke to Dr. Nelson, and he said if a patient misses 1 or 2 laser treatments, that they can catch up, and it will take 1 or 2 treatments to get back to where they were, but that they definitely can catch up. Is that how you feel as well?
Yeah, absolutely. It's okay to have a temporary hiatus, as long as that hiatus is not too long. Now remember this, if a child is having anesthetics for treatment, and we wait too long and we get behind where we were, that child may end up having more than a greater number of anesthetics, and that's something we want to avoid. So, we'll evaluate these on a case-by-case basis. I certainly don't want to expose a child to more anesthetics than they need, but then on the other hand, we've got to see what the risk of COVID-19 exposure is all about. I can talk about a number of issues. The European group, which is headed by Laurence Boone, it's the European Reference Network, sent me some issues that they had discussed. And one of the issues is if a child is on sirolimus, should the child stop taking sirolimus? Well, this is a very good and very important question. We know that sirolimus is an immunosuppressive drug. And under those circumstances, immunosuppression is not very good, especially if a child becomes ill or infected with a viral illness. The recommendation of the European group is that the child should continue sirolimus, but stop immediately if the child becomes ill. So they are recommending that the child continue sirolimus, but should stop immediately if the child becomes ill and seek medical advice. That's the European view on this. I'm not 100% sure I'm completely comfortable with that. We know that sirolimus is an immunosuppressive drug. Is immunosuppression going to be a major factor when it comes to vascular anomalies? When it comes to COVID-19 infection? Well, one of the reasons that kids do much better than adults is because they have a good immune system and they're very, very robust. However, if you follow the news, there was a 16-year-old who died in France just a few days ago. So, young children are not that immune, especially the very, very young, the under 2s and under 3-year-olds. So I'm not 100% sure I'm comfortable with that. My feeling is that if it's possible to stop sirolimus without any undue problems, then I would consider it. Obviously, you must speak to your doctor who's treating you, and you must take the advice of your doctor, but I'm not comfortable just openly or throwing a blanket out and saying as is. I think there could be problems, and I want to, in order to avoid these problems, speak to your doctor, but remember, it is an immunosuppressive drug. If you can stop, I would say stop. If you cannot stop, and it's not possible for you to stop, well then continue with caution, but make sure the child is isolated. So
that's what I was going to say. If it's an adult or a child on sirolimus, especially if they're in a congested area like New York City or LA or areas like that, that they should be really quarantined, right? I mean, that's what you're saying. They should be quarantined.
Correct. Now, what about propranolol?
Well, we do. I just want to, because we are getting some feedback, but not question, but Jenna Garner said, thank God she had just had an appointment with you right before the pandemic, and you stopped the sirolimus just in time. So she's really glad that she was able to get in and see you, and that, I don't know if you remember her, but Jenna,
Yes.
yeah, so she said she was really glad that she got in. Tam Bam says, hi, you just did the surgery on her daughter with the massive hemangioma on the skull, and she had a outcome. So, okay, so now, because I'm not seeing a lot of questions, I think people are really listening. But if you would like to address, are you going to address the beta blocker, propranolol?
Correct, yeah.
Okay,
Correct.
thank you.
So we know that propranolol is not an immune suppressive drug. However, one of the side effects of propranolol is that it causes, or it can potentiate, constriction of the airways. In other words, it can narrow the airway. So, under these circumstances, a child who's on propranolol, who does not have wheezing or any other respiratory condition, and there's no contraindication to being on propranolol, should continue. However, if the child becomes ill, then that's something that you have to take under advisement. If the child becomes ill, and I'm just looking at the European response, beta blockers are not immunosuppressants, but they can worsen the symptoms of a viral infection, such as wheezing. So if a child has fever, gastroenteritis, lung symptoms, you should contact your healthcare provider immediately and just warn them of the fact that your child is on beta blocker, on propranolol, and the child has these symptoms, because under those circumstances the beta blocker can make things worse.
And then if they are taken off the beta blocker and once the child recovers, they can resume the propranolol?
Yeah, correct.
Okay. We do have a question from Wojciech Kozanuski. He said, is there any problems with venous malformation on the left side of the face and tongue? High level of OD dimer. My daughter is 8. Has 8. She's 5 years old.
Yeah, no, there should not be a problem. Really, I don't think that this is going to be an issue at all. So, yeah, it should be fine. Any person with a vascular lesion, the vascular lesion itself is not a problem. So, for instance, well, let me get back to, there are 2 things that I want to discuss. Please remind me, Linda. One is Sturge Wavis.
Yeah, that was the next part of Wojciech's question, because his daughter has seizure disorder and she's on anti-seizure meds.
Okay, so we can address that now. Anti-seizure meds are not contraindicated at all. They do not interact with any of the issues at hand, so they should continue. And I'm just looking for the European response. Yeah, they should continue with anti-seizure medication. Anti-seizure medications should be continued if your child has, even if your child has had positive exposure, right?
Okay.
Fevers will lower the threshold for seizures, but these medications are very, very important. And obviously speak to your healthcare professional. So, if you're on seizure medications, continue. If your child has had exposure, continue. If the child becomes ill, these medicines are very important because fever will lower the threshold for a seizure, and so the meds are important. Okay, there is one thing that I want to get back to.
Can we take some questions first?
Of course.
Okay, so Chelsea McCabe said, should you isolate if your child is on propranolol or just discontinue if there are symptoms of illness, of the COVID?
Yeah. Well, it's always a good idea to isolate the child or keep the child isolated. For the reasons that I gave you, the propranolol doesn't affect anything to do with COVID-19, but if the child has wheezing or any airway issue, then being on propranolol can obviously make things worse. So what I would do is, and in fact, I think we mentioned this earlier concerning propranolol. Hang on a minute, let me just find it. Yeah. So if the child has, the child has an underlying heart condition, beta blockers are not dangerous. They're not immunosuppressive drugs. They can worsen the symptoms of a viral infection. So if your child becomes ill, then it's a good idea to stop and notify your physician. So if the child becomes ill, stop and notify your physician.
Okay, so we have more questions coming in. One you kind of addressed, but Christina Garrett Senegan just got on. Her 4-month-old has had 3 treatments with her port wine stain with Dr. Geronimus before the pandemic. She wants to know, will that clearance hold, or will she be essentially starting over? I don't know that we know that, right?
No, first of all, you're not going to be starting over. You will have derived some benefit from the treatments. Excuse me. I know that Dr. Geronimus treats very frequently. So if you take, whereas some of us don't treat that frequently, so there is some controversy there. So if you take a temporary lull, in other words, if you stop treating for a few weeks, it's not going to make any difference, and you definitely will not go back to square one. You might see some worsening of the port wine stain or some darkening, but you're not likely to see darkening until at least, I'd say, 6 to 12 weeks. So after, I'd say, realistically, depending on the port wine stain, you're not going to see much darkening till after about, I don't know, 10, 12 weeks. So you're in good shape.
I'd like to add, too, because the only thing most of us can do is take a walk outside. It's critical right now for parents and adults with port wines and the babies to make sure they have on a lot of sunscreen, right, Dr. Waner? Because
yes,
that's a real big thing that, since, you know, getting sun is what we're all looking for right now, make sure you have the sunscreen. Margaret Holdova is saying hi from Russia. She says they're waiting for their borders to open. Carlos Parazaris wants to know, is it true that NSAIDs make the COVID symptoms worse? I take naproxen when needed. So he may take it for pain for a VM. I'm not sure, but he wants...
Okay, so there was this issue and it did come up. There is no scientific proof that non-steroidal anti-inflammatories actually make this worse. There really is no scientific proof. And let me look at the Europeans' response. They say that there have been rumors, but that these are unsubstantiated. There's no solid data whatsoever to support.
The Harvard website says the same thing. They say there's no scientific evidence, but to be super cautious, you could just switch to Tylenol if you want.
But some people are on non-steroidals for a different reason, and in the absence of any scientific data or evidence, just continue. I just cannot see any reason why non-steroidals will actually affect this. So that's unlikely. Okay,
so we have more questions. Erica Serna wants to know, what about taking aspirin as a blood thinner? There are a lot of KT patients that take it.
Yeah, no problem. Continue.
Okay, and Noel says his son, Noel Adorna says her son is 10 years old. He takes Bassin 3 days a week and Sirolimus 1.5 milligrams. How compromised is his immune system? Is he considered immunosuppressed?
Okay, so for the reason that the child is on these meds, especially Sirolimus, yes, the child is immunosuppressed. Right? There's no doubt that Sirolimus is an immunosuppressant. So for these circumstances, or for these reasons, take extra precautions. Make sure that the child is isolated and not exposed to anyone. but I think you can continue using the meds, and as I said, only stop the meds if the child becomes symptomatic. But remember, you must be under the guidance of your healthcare professional. So whoever is treating you should be notified and should make that decision.
Okay, Kristen Kunkel said her daughter has had a dry cough since she started propranolol months ago. Her husband is a first responder and will bring COVID-19 home. Should we talk to the doctor about discontinued use before she gets sick?
Yeah, I definitely would do that. If she's had a cough since then she's probably experiencing some degree of bronchoconstriction. So under these circumstances, it's important to, I would continue it.
As we all are working from home and we're hearing from Dr. Waner's cute little dog.
Yeah,
So while we're waiting for the next question, so you talked about...
Yes, I have a statement.
Okay, go ahead.
So one of the issues is, what if the child has a hemangioma of the airway and is on beta blockers? This is a very delicate situation. Sorry, I can't stop the dog because the plumber just arrived. This is a very delicate situation. The child should continue with the propranolol, but you must contact your physician because this could lead to problems. So this is something that could be very critical if the child has an air lesion. Continue with the meds, but please notify your doctor and tell them that you're on propranolol and your child has an airway lesion, and take advisement from them as to what you should do.
Would you do anything like, is there any population with vascular anomalies in the airway that you would want to keep like an inhaler or something, like just nothing like that? Okay.
No, not at all.
Okay, so Linda Rokeson has a question. She said, is there any reason for concern with a PIK3CA inhibitor during this outbreak?
No, there isn't. Not at this stage. No.
Okay, so Lori, she can't watch the video. Lori Little Shield, she's one of your patients from back in the Arkansas days, so she said she'll watch later. Katie Woolsey has a 16-month-old, and she's yet to have a confirmed diagnosis with CLOVES or MCM. She's waiting for her biopsy from Great Ormond Street. Is she high risk? She's not on any medicine at this time.
No, she's not a high risk. Not at all.
So Watchstick wants to know and they're from Poland, and they said hi. He wants to know if you're afraid of the COVID-19 virus.
Oh, yeah. I'm in the age group that could put me at major risk, so clearly I take these things seriously. I'm a physician, so I go into the hospital and see patients, and we just continue working. Our elective surgeries have been cancelled, but then there are emergency tracheotomies and things like that, so naturally I'm very concerned. But we have protection, and so I'm a physician, so I must keep working. There's no reason for me to stop. Here's sick people, and they need help, so we must continue.
So Ahmad Alagab from Saudi Arabia says best regards to you. Yes. And Nili Tedavasyan is watching also. So waiting for some more questions to come in. So also, what about women that have vascular malformations themselves and they're pregnant? Do you think that they should really isolate, especially the ones that have to take like blood thinners, the women with KT or overgrowth syndrome that are pregnant right now? Are they, would you put them in an at-risk population?
Well, yeah, because we don't know. We know that today evidence has just been released that the COVID-19 does cross the placental barrier. So if a pregnant woman is infected, the virus will get into the fetus. So it depends on the trimester of pregnancy. So we don't know how this is going to, what sort of effect this will have. We're concerned in the first trimester, but we're less concerned in the second and third trimesters. So, these are some of the issues that we have. Let's talk about some of the drugs, because this is very, very controversial. And, there are people talking in different directions, and so there's a lot of confusion as far as this is concerned. Dr. O and I just recently, about a few hours ago, we put together a consensus from colleagues of ours from all over the world. So we contacted friends in Shanghai. These friends are all physicians in charge of similar situations to us. So we contacted colleagues in Shanghai, Hong Kong, Korea, Daegu, which is the epicenter. We also contacted colleagues in Milan. My first cousin there is a intensivist. He's an anesthesiologist in charge of an intensive care unit in Milan. And we contacted colleagues in Spain as well. So the consensus, and there were specific questions concerning the management of the airway and also tracheotomy. And that's a major concern, because as otolaryngologists, we will perform tracheotomies, and during this procedure there's a lot of aerosolization of the virus. And how do we protect ourselves from this? So that was most of the discussion, but a lot of the discussion centered around hydroxychloroquine and some of the other drugs. And I know this is controversial. I know that we don't have any data to prove that hydroxychloroquine works. We only have anecdotal data to show. There was a very small French study which seemed to show that there was some benefit. And there was also a second small study somewhere else with also 30 patients which showed no benefit. And that was recently, I think, published on the Bloomberg News media. We don't know the truth, but we're in an emergency situation. We don't have the luxury of time to conduct phase 1, phase 2, phase 3 trials. We don't have 18 months or 6 months or a year. We're in an emergency. And under these circumstances, most of the people that we contacted are using hydroxychloroquine and one or other antiviral agent on their patients. So there is remdesivir, hydroxychloroquine, and a few other agents that are being used. So the fact is that most of these are using drugs. I know that we don't have clinical trials, but we don't have the luxury of time. We're in an emergency, and under those circumstances, these drugs should be used. Now, the question is, should everyone be taking these drugs? No. Only use the drugs once you become symptomatic.
What about the zithromycin?
Zithromax, right. So, thank you for reminding me. So, Zithromax, or azithromycin, or azithromycin, together with hydroxychloroquine, seem to be very, very effective, at least in a very small study which was undertaken by a very well-known group in France. They showed complete elimination of all virus in about 5 days. They showed that hydroxychloroquine on its own was effective, but the two combined, hydroxychloroquine and azithromycin, seemed to be much, much more effective in eliminating the virus. And this makes sense because hydroxychloroquine does have antiviral properties, and it seems to stop viral replication. So the way a virus works is that it infects you, and the virus particles take over your cells to make more virus particles. So in other words, they turn you, the host, into a factory to produce more virus particles. That's the way it works. So hydroxychloroquine stops viral replication. So in other words, it stops the factory. It stops the virus from making more viruses. And that's the way it works. Azithromycin is an antibiotic, but it also has some antiviral activity. So the two combined do seem to make sense.
And people can usually get those from their physician, right? Like a script for them.
They're available by prescription. So at this point, we're not, some people are taking these prophylactically. So in other words, if you are over 65 or you have certain medical conditions which would make you susceptible and increase your risk of succumbing to this, then under those circumstances you may consider prophylaxis. And the prophylaxis is hydroxychloroquine alone. But once again, you need to be guided by your physician. If you become symptomatic, then hydroxychloroquine combined with azithromycin seems to be very, very good.
And I think that caution is important because in the U.S. they've reported a couple deaths from people who just treated themselves with that hydrochloride.
You should not be careful. You should not self-medicate.
Right.
Always speak to your physician in terms of dosing and in terms of other issues. Hydroxychloroquine has some cardiac issues. It prolongs the conduction interval within your heart. So in other words, it can cause some cardiac problems. And so if the patient does have cardiac issues, they should be very cautious about taking hydroxychloroquine and speak to their physician.
So we have a couple of your patients, Amanda McSorley from Derry, Ireland, and with her daughter Megan saying hi to you. And also Gladys Fairfan Townsend. Her daughter is in Lima, Peru, and she's actually in Montana, so she was probably visiting and not able to get home. And they're thanking us. Everybody's thanking us for doing these important sessions for families affected by vascular birthmarks, anomalies, and related syndromes. Again, to restate what you're saying, for people to kind of stay the course on their medication, but then if they become compromised by COVID, that's a time to reevaluate with their physician, correct?
Correct, absolutely. Yeah. Absolutely. Now, the people who are having issues, according to the Europeans, are people over the age of 50. Now, previously, you remember it was 65, but the European statement says people who are over 50, people who are smokers. Smoking is definitely a major risk factor. And people with serious chronic medical conditions, such as immunosuppression, diabetes, hypertension, and other autoimmune diseases are especially at risk. Patients with heart conditions and patients with lung disease such as asthma, chronic obstructive pulmonary disease, etc. These are patients at risk. Hypertension, high blood pressure, is a risk factor. Chronic liver or kidney disease is a risk factor. And obviously patients who have ongoing malignancy and are currently on treatment are at risk.
Now, a couple other questions. Oh, okay, so Christina has a question. She said, is there any discussion about antibody extraction from the breast milk of lactating women who are exposed or recovered? I'm a nurse practitioner and expecting to get COVID at some point just based on exposure and am breastfeeding, and hope that this will provide my baby some protection.
Yeah, that's very good. As a healthcare provider, that breast milk is rich in antibodies, a specific antibody called IgA, is excreted in breast milk, and these antibodies are very active in cell-mediated immunity, which is important in viral illnesses. So that becomes an issue. But then again, we also know that breast milk will secrete, probably, if the virus crosses the placental barrier, the virus will probably cross into breast milk. So, there's a double-edged sword here. I don't want to be an alarmist and stop everyone from breastfeeding. We also know that kids are pretty hardy as far as this is concerned. So just carry on doing what you're doing, but understand and know these facts.
So Megan Corbett has a question. Her daughter has mast cells as well as veno-lymphatic malformation. Does this make her more susceptible for getting COVID-19? I have voluntarily decided to stay home for over 2 weeks now. I'm not super worried, but just being more cautious.
Yeah, the answer is no, it doesn't make you extra susceptible, but being cautious is very good. I don't want to be too controversial here, but in reading all the different responses to the medical community responding, and then we have government responses. If you look around the world, different countries are responding in different ways. So, for instance, Sweden is less strict about many things than some of the other countries, and their response is based on what they believe is scientific data, which shows that ultimately we're all going to get infected. And so what they're trying to do is blunt the waves. They want to reduce the number of cases so that the health facilities are not overwhelmed by cases. So, but ultimately, I think we are all going to get exposed.
I think there's a question too, and I even ask myself, the more they say early symptoms, they're talking now that COVID-19 may have been here in early January, and I remember having sniffles and red eyes and a headache and some things, and I think there's going to be a number of us that this could have actually passed through without us even knowing it, correct?
That's correct. That's correct. And early symptoms are definitely reduced sense of smell and reduced sense of taste. Now, some people, here are alarming things. Some people just have reduced sense of smell and taste, and if you do a chest x-ray on them, they've got obvious evidence of the disease. We've seen some people with just minimal symptoms, and if you do a chest x-ray, you see obvious evidence of disease. So, clearly there's a huge spectrum of response, and your response is based on your immune system and all these other factors that I mentioned. Age is one in particular, over the age of 50, not 65, but it's over the age of 50, which seems to be a problem.
Or you said, like you said, somebody who maybe they have chronic pneumonia, chronic bronchitis, very severe asthma, very bad allergies even, which cause respiratory distress for a lot of people, and airway obstruction.
Correct.
Right? So,
Correct.
Yeah. So Christina DiMartino said, "Hi, Dr. Waner. Little Mateo is doing fantastic. We thank you and hope you're staying safe. We're quarantining." So.
Okay, and Mrs. DiMartino, you should just carry on seeing us. Don't worry about all the other issues that you were concerned about. We'll make a plan, okay? So, obviously I don't need to see you now because you're quarantining, but after this is over, just carry on.
And with your telemedicine, Dr. Waner, are you Skyping or using what?
Yeah. Anybody can contact me, and I'm available 24/7. Many people know my cell number, and they should just go ahead and use it. If they call the office will contact me through the answering service, So I'm available for everybody, for all the patients.
Yeah, we've been posting your number, the 212-434-4050, repeatedly. Dylan's been posting it, our communications director, throughout this session. So if people want to contact you, and like you said, you'll offer a visual type of telemedicine, because, you know, like I've been getting tons of messages from parents with early emerging hemangiomas saying, you know, my doctor won't start the baby on propranolol because they'd have to come in the office and have a cardiac workup, and they're just not doing any of that right now. I don't know what to say. I just tell them, like, give this a couple weeks and they might be able to start them on the propranolol then, but, you know, I don't know.
Well, I mean, there are issues there. So, for instance, now I understand doctors' concerns, and I understand a lot of the offices are closed. But telemedicine is pretty good at actually evaluating some conditions. So, for instance, if you see a child with a very small hemangioma on a or on a face, and you've got a pretty good photograph of the lesion, you have a pretty good idea of what's going on. And based on that, and if I was able to actually speak to the family, I would be comfortable starting something, provided I could speak to the family and provided I got a pretty good history. I think it's safe. So if you see a small lesion, that's not an emergency. However, if the family contacted me and I was able to get a good idea of what was going on, I would be comfortable treating this family.
It's really important for these. Petra Potgiertier from South Africa says hi. Potgieter. Petra Potgieter.
Potgieter.
Potgieter. Okay, Petra.
Yeah,
sorry.
Yeah.
Tough one. So she's saying hi. Nadia Debuche Sereta. Okay, she's grazie per tutto. She's saying she's very happy and take care. Thank you.
Likewise,
yeah.
Everybody should take care.
I think that's probably one of your Italian patients that's writing. And another thing, Dr. Waner, so a lot of patients are getting treated in countries right now that haven't even seen the apex of this disease. And of course, here in New York, where you and I are from, we're just approaching the apex. So do you think they should be taking the same precautions, even though, like, just yesterday, Ireland went under quarantine, or the day before, and there's still, like, a lot of states in the U.S. that aren't under quarantine in a lot of countries, but are you recommending that they maybe self-quarantine just to try to flatten this curve out quicker?
Yeah, no question. You know, if you feel exposed, if you feel anxious about this, if you have a young child, you know, take the initiative, then isolate yourself. But you have to realize that this thing is going to go on. It's not going to disappear in 2 weeks. You know, we're not going to see a sudden, you know, the end of COVID-19. COVID-19, like all coronaviruses, is here to stay, and it's going to make the rounds, and, you know, we'll see it for some time to come. So, you know.
Is it your opinion, even though this is obviously a pandemic and it does attack the bronchi and lead to pneumonia, but there have been other ones, the SARS and N1H1, and So I mean,
the interesting thing, Linda, is you know, after SARS and MERS, which is the Middle East respiratory syndrome, certain drugs were developed to combat these, and these were antiviral drugs. One of them is remdesivir, which is manufactured by Gilead Pharmaceutical, and there are a few others. Now, of these, it seems, we don't have compelling data yet, but it seems that remdesivir may be active against this virus. So that's kind of where these things come from. And that's also hydroxychloroquine was also something that was investigated during the SARS and MERS epidemics. And the research that we have is as a result of those. And those viruses are of the same family as as COVID-19. So, there you have it.
So Brianna Harned said most VM patients are full of blood clots. Are they more at risk of a pulmonary embolism with COVID-19 turning to pneumonia?
No, not at all. There is no evidence of any of that and no likelihood of any of that.
Okay, and she said her daughter has extensive venous malformation.
Correct. And I just wanted to say something. You mentioned a patient of mine from Saudi Arabia. If he's concerned, he should contact me, but he has no reason to be concerned. This is not going to make things bad. However, if he should become infected, he must contact me and his healthcare facility at home. I just wanted to get that message across.
Yeah, and I mean, the other thing, I just want to mention this for myself, is I'm allergic to the Z-Pak. So are there alternatives, like if I were to get the virus? Or would...
Now, are you allergic to the family of the... Azithromycin belongs to a family of antibiotics called macrolides. And this is a big family, and there are several of these antibiotics. Now, it depends on your allergy. If you're allergic specifically to Zithromax, then we've got to figure out what your allergy is all about.
Well, the last time I used to take it all the time for chronic sinusitis, and the last time I took it 7 years ago, I broke out in hives. So then they just stopped giving it to me and switched me to Cefdinir.
Yeah, that which is a cephalosporin. That's a different family. So, Linda, I would say that you should not take Zithromax or azithromycin because clearly you're allergic to something. Your allergy is not bad.
No, it's just hives.
Right. If, God forbid, you're in a hospital and you're an extremist and nobody is expecting or even closely, remotely near that, but if you were in a situation where it was necessary to treat you, it would be possible to use this medication.
Yeah, I was thinking of that.
Under supervision, if
right.
you're in a hospital, in a monitored situation.
I was thinking of that.
Act immediately. Okay.
Yep. So Corinne got a question, and she said she copied me. A 17-year-old with a brain AVM, newly diagnosed. The mother passed away. The aunt is trying to help him. She applied for Medicaid for him, but COVID-19 has forced them to close their lobbies, and we're basically being told, being told to wait for a letter in the mail. She went to the ER, but they sent him home as the AVM is not bleeding, being turned away for treatment by neurosurgeons because he doesn't have insurance.
Okay, all right. So provided the AV malformation is not active, he's not bleeding, he doesn't have any, he's in a fairly stable situation, this can clearly wait a few weeks. I would not be comfortable waiting longer than that, but certainly for a short period of time, provided the patient is not symptomatic, provided nothing is going on. We all know that AV malformations can progress, especially brain lesions, and so unfortunately nobody is evaluating this at this point, and so we're in a difficult situation. But I would say it's okay to wait for a short period of time, not for a long period of time. He should be evaluated.
But, and especially, maybe, I'm just thinking if this guy gets COVID and gets a fever and he's got a brain AVM, that could be a problem.
Yeah, you know, Linda, I'm trying to think if there are any major issues. I don't think so. I really don't see anything. This, you know, COVID-19 is a respiratory condition. The worst thing that you're going to have is all the effects are all pulmonary. In other words, lung and airway issues. The AV malformation is...
I was just thinking of fever. I was just thinking of fever.
Yeah, the fever could be is the only issue, but
yeah.
even that, you know, is not. It's not gonna. I guess if you have a high fever and a high heart rate, that's not good for an AV malformation. So the fever should be treated.
So Sarah is from Milan. She may be one of your patients. She said, oh yes, she is. She said, thank you for everything. Alice is better now. As she got her vascular malformation. She has the vascular malformation in her mouth and tongue and face. They're in quarantine and they're from Milan. And she said, it's very difficult here. We're very worried for their daughter. So,
So I'm in touch with I have family in Milan. One of my family members is a doctor. The other is a physicist / mathematician who is constantly doing statistics for the government. And so I'm in constant contact with them. And it seems that there is some hope in Italy, especially in Milan, that the numbers seem to be flattening. So we seem to be over the top of the wave in Italy as far as, or certainly in the province of Lombardy, as far as this is concerned. The major concern now is the rest of Italy and the spreading further south. That's a major concern, and as we know, some of these areas are not equipped to be able to deal with such an influx of patients. Northern Italy, certainly Milan, is more capable of dealing with a major influx, so there is a lot of concern as far as this is concerned.
And we also have Dr. Giacomo Coletti in Milan. He's a maxillofacial surgeon, and he's doing telemedicine right now too. So, I mean, if there's like an urgent need to be seen thing, I don't know. I'm just saying, I know you can do the telemed, but somebody may need to be seen in person, right? I don't know.
Yeah.
We can give you that information. So we have about 8 minutes left. See if there's some new questions. Africa is on a 2-day lockdown. She wants you to know. Yeah, she wanted you to know that. Dr. Waner's from South Africa, so.
Yeah, so I have family in Cape Town, and I'm in constant contact with them. And, sorry, I don't have coronavirus. They've sent me some very interesting videos of some events that have taken place in South Africa, which are somewhat concerning. But, yeah, I do follow the situation very carefully. I think it's very wise. There has been a spate of cases in South Africa, and I think it's wise to be proactive about this. I don't know how effective the lockdown is going to be. You know, one of the issues is, will everybody heed the warning and stay indoors? I don't think that's going to happen, knowing South Africa, but yeah, I follow very closely.
Well, I mean, even in New York State, I mean, you know, we're you know, downstate where you are, where there's 8.4 million people in a 550 square mile radius, they're having a lot of cooperation, but still, you know, a lot of issues with compliance as well as anywhere. You can still see, you know, people gathering, and it's 2 weeks now in, and everybody's frustrated and at each other's. I mean, you become a teacher to your 2 kids now, right? Your 2 boys are, you know, in what are they in, 4th and 5th grade, something like that right now, right?
Yeah.
Yeah. So I mean,
it becomes a very difficult know, it is what it is. You've got to cope with it and do your best.
And the other
my heart goes out to all the people in severely affected areas such as Italy, Milan. You know, this is something close to my heart, and so I've been in touch with my family all the time. It is an issue. It's very disturbing and very...
Well, we can only hope and pray that it ends soon, and we can all do our part by staying inside. I'm listening to Governor Cuomo. You know, he's taking a firm stand with this. He's really, you know, just come through to be a really amazing governor. Everybody, I mean, I was on the phone with Ariana yesterday from Italy, from Pavia, and she was saying he's constantly on the news, you know, in Italy, that because everybody's recognizing him as a force to be reckoned with, they're kind of comparing him to the Sopranos, you know, that nobody wants to mess with Andrew Cuomo because he's like, yesterday he said, we're going to kick Corona's ass, and everybody's like, that's the attitude. We have to really kick it, and the way we're going to kick it is by staying indoors so that we can flatten the curve and washing hands, social distancing. The only person I've seen in 2 weeks is my daughter. You know, she's the only one that I've been around. And it's okay. It's a sacrifice, but we'll get through it for the sake of everybody, for the sake of the elderly and the immunocompromised and you know, you said it, Dr. Waner, there are young, healthy people dying from this, so we don't really know everything. We're learning new information every day. And then for people that were scheduled for surgeries with you in April and even May, and because you said, you've told me how sometimes you can book out for 4 months, will you be able to get them in soon? Like, will you be able to?
Linda, things are changing on a day-to-day basis. We don't know. I mean, I can't predict what's going to happen at the end of April. I hope that there will be some loosening or some, you know, loosening of these restrictions. The Chinese situation is very interesting. The whole process took them about 2 months. But remember one thing, they can do things in China that we can't do here. They have much stricter control there, and they certainly have tighter control over their population. This is not something that we can do and we can replicate. So I'm not sure. I think we've got to do it on a day-by-day basis. I would certainly want to get back to work as soon as possible. So we'll see what happens.
Yeah, and just pray for this to end. VBF has its conference scheduled for September 25th in New York City.
I'm sure it'll be okay by then.
Yeah, we're hoping and trusting and believing that everything will be okay by then. We're keeping in close touch with all our families that have registered, and as soon as the dust settles and the restrictions have been eased, then, you know, we'll get back on track with promoting it. But in the meantime, you know, as we wrap up here, I want to thank you, Dr. Waner, for all this very informative information on how COVID-19 can impact our families affected by various vascular birthmarks, anomalies, and syndromes. And I think the takeaway is, yeah, there can be some comorbidities with some of our patients, but they need to stay in very close contact with their families. I mean, with their physicians that are their treating physicians for their vascular condition, whether it's a malformation or a hemangioma or a port wine. Oh, Brianna, no, there is no deadline to register for the conference, so just keep track of everything going on. You know, it's open right now. We're taking registrations, and if something happens, everybody will, you know, be given ample notification. So,
okay.
Yep.
Linda, just one takeaway message. The only area of some concern, not major concern, but some concern, is those patients who are on sirolimus and as a consequence of this are immunosuppressed. They shouldn't continue their medication. If they become symptomatic, they should immediately contact their healthcare provider. And my opinion is that if they can possibly stop, they should.
There was one more that we forgot to mention because there is a support group and the people are on here. That's the Cassavac-Mera Kaposiform of Hemangioma Endothelioma groups. And those babies can be on combos of steroids, sirolimus, vincristine. I mean, they're major compromised, aren't they?
Yeah, anyone who's on steroids, steroids are immune suppressants, and they suppress something called cell-mediated immunity, which is specifically what your body relies on for viruses. So this can be a problem.
And aren't some lymphatic malformations patients put on steroids?
Yes, less and less nowadays. We usually use steroids for the acute exacerbations. In other words, when they become acutely worse. But because of the effect of steroids on the immune system, I'm not inclined to use steroids in this phase, in this acute phase right now.
So a patient with a lymphatic malformation that might be on sirolimus, if they do contract COVID-19, they definitely should not be given steroids, especially if they have like an inflammatory response.
I don't want to say that.
Okay.
I want to say that they should contact their healthcare provider, and this should be considered on a case-by-case basis.
Because it can have some complications.
Correct.
Correct. Well, thank you so much, Dr. Waner. It's been very informative. Everyone is thanking us. They're all saying for you to take care and to be safe because they need you. You have to be well for all your families that need you. And hopefully, as things go on, we may be doing another one of these sessions with you in next month. And we thank you for your time and stay safe. Thank you.
Thank you.
Yep,
Thank
bye.
you very much.